Hi my lovies, hope you guys are doing well. Welcome back to my YouTube channel. To the beginners, I really appreciate your support and thank you for joining me on this venture. And to the returners, whom I love calling as such, I hope it's not a problem for any of you. Thank you so much for being with me from the beginning of my journey up until now. I truly appreciate it. From this side, much love. To your side, of course. So guys, without further ado, today I'm going to be talking about my latest experience in the dental fraternity, the world that I live in, the world that I work in, the world in which I'm hoping I'm going to flourish, you know, like from some little duck to a swan, right? So here's the thing. I had a very challenging moment last week, and look, I'm not one who's usually not very confident. I don't feel confident today, to be honest with you guys. I don't know, I've been thrown off by that. And mind you, I'm not one person who does not take punches, you know. I mean, I'm that person, like, life pours a punch and I'm like, okay darling, it's fine, you know, let's just, you know, pull up our socks and just move on. But last week I found myself in shambles, if that's the right word. I hope it is. It wasn't a very great feeling, you know. So I'm currently on a seller rotation, right? So what we do in BDS5 is that there's different rotations for different groups. So I'm on seller rotation, that is service learning. This is now when you do your practicals or clinical practicals outside the vicinity of the university. So we usually use the Mercy Clinic. I think Eco Winterfeld. I hope I'm not wrong. I think Eco Winterfeld for the seller thing. So we leave here around 8ish, 8:30 in the morning, and then we get there, we start working and blah blah blah. So it's like a clinic that's always running, you know. Most of the time it's run by students. Now, one of the biggest reasons why we're being taken there is because they want us to learn how to become accountable, how to know how to stand on your own 2 feet, you know, without a person who's supervising you breathing down your neck and all these things. And the other thing is for you to learn leadership skills to plump up your confidence as well. Because I mean, you know, when you're out there away from the dental hospital, it's almost as if you're the one that's running the practice, you know. So yeah, it's like a learning curve of some sort, like a learning approach of some sort, which eventually is supposed to give one that feeling, look, I have arrived. I can run a practice wherever, or I can hold a fort, you know, during your ComServe years and whatnot. So I think it was on a Monday, last week Monday, yes. A man walked in to the dental clinic of Mercy with his daughter. So when this guy came with his daughter, I thought the guy was there to extract his tooth, or maybe say the child needed an extraction or whatever, you know. So, yo guys, when they got there, like, you know, hi, how are you doing? We're okay, and blah blah blah. You know, the whole thing that you do at the beginning. You know, you need to build some rapport. You don't just get a person walk into your surgery and you're like, okay, go and tell me. No, it doesn't work like that. I mean, honestly, you guys should know that, right? You need to also practice hospitality and everything else that comes with it, you know. So they walk in, fine. I greet, you know, take vitals and blah blah blah, you know, all that. And then the father says, my child has a problem. I'm like, all right, what's the problem? He shows me a lesion on her gingiva. Gingiva is gums, ne? On her gingiva. It is a papillomas one. So when I looked at it, in my head, the first thing that came to my head was, oh, human papillomavirus, you know, as a differential diagnosis, of course. And at the same time, I'm thinking, okay, but we can consider your common words and what, but in the mouth, very seldom. Shabo. So I happened to question the child first. I'm like, okay, how are you doing? I'm alright. How old are you? She was like 11 years old. So I say to her, alright, so what's the problem? She's like, no, I'm having something that's growing on my gums. I don't know what it is. It's been growing for quite some time and whatnot. So I of course I wanted to see it. You know, I'm not supposed to touch it barehanded and whatnot. So I went to go grab a pair of gloves. This is now during the screening process, right? I grab a pair of gloves. I come back and I check and I see this lesion on her gums. And one thing that we know usually as dentists is that some of these lesions come from engagements of oral sex, right? Because with that lesion, it's a contact lesion. You don't just, it doesn't just grow out of the blue, you know. But now we're still in the aphasia differential diagnosis. Nothing is set on stone as of yet, right? So I turned back to the father and I'm like, okay, so when did the child start telling you about this thing? And then he's like, a few weeks back and whatnot. I'm like, all right, that's okay. I go back to the child and I'm like, does it hurt you? No. When did it start growing? And then she's like, I noticed it around 7 years of age, and it's been growing very slowly, you know. So I'm like, okay, right, that's okay. Now in my head, remember, you know, when you're doing your clinical examination, you have to probe and probe and probe in the correct manner up until you find what you're looking for. And it's part of the reason why we take your social history, your medical history, dental history, literally everything. You know, I need to know your background, socioeconomic status, who do you live with, when are they around, all these things, right? Chilled. So I got a bit scared. Doesn't happen a lot. I got a bit scared, you know, to probe more with the parent there, especially because he's a man. Sometimes male patients are just intimidating, you know, especially because he's a man. So I was like, okay, panicking. I went to my supervisor. I'm like, Doctor so-and-so, I'm having a bit of a problem having a conversation with the guy. Why? She asked me. And I'm like, I noticed a lesion in the child's mouth. And what we know from previous experiences is that this lesion is usually caused by direct contact. And most of the time when you see such a lesion, especially in the mouth, it has to, you know, raise your ears and alert. And the first thing that I thought about when I saw it was oral sex or oral abuse, sorry, sexual abuse, you know. And then she looks at me and she's like, okay, go ahead. And I'm like, no, I don't want to go ahead. I want you to come and assist, you know. And then she's like, no, actually, I'm not going to do that. Now it's over there, my brain stops working and I'm there like, wow, what are we doing? And then she's like, no, I get it when you're here. You need to learn. You're going to run a practice soon. You're also going to be alone. Go come serve. I'm like, yeah, but I'm not alone now. Anyway, it wasn't a very long conversation of her resisting and me forcing her and whatnot, you know. She's quite a nice person. So she's like, okay, right. If you were alone, wherever you're placed, what would you do? I'm like, okay, I think I'll take the child alone and have a conversation with her. And she's like, why don't you do that? I'm like, with what? And she's like, yeah, please, Jade, go ahead. Shaba, I go back out. I call the child. I ask her a few questions. And to all my questions, she says no. But you know, you can tell when kids are gullible. Or more, no, there's something that she's hiding. Or there's something that she's not understanding. And it seems as though there's something going on. You know, she can't tell me about, or she's been scared out of talking about it or whatever, right? So I go back and I give feedback to my supervisor. I'm like, you know what? This child, on some level of fragility, and you can tell that she's very gullible, she's very vulnerable. Of course, she's a child. I mean, all kids are mostly vulnerable, but I can't get a lot out of her, you know. So I'm going to put on my big girl panties and go talk to the dad. And she's like, I'm very proud of you, please do that. Now I'm scared, like literally very scared. So I go back and I tell the dad, I'm like, you know what, maybe let's step into one of the cubicles. Let's just have a conversation, because I spoke to a child. Oh, of course, I asked for permission before getting one, and he agreed. I spoke to a child, and I'm not quite happy with the answers I'm getting from her. Right? What do you think the problem is? So I go and Google HPV. I go and Google HPV, and I'm like, please read this and read it with understanding. Where you are lost, ask me. He reads it, and then he looks at me like, and they're like, is there a problem? He's like, I don't understand what's written. I'm like, read it again. He reads it again. Are, oral sex. I'm like, But also please note, we have not proven beyond reasonable doubt that this is definitely what I think it is. Then I explained to him, before we get to a conclusive diagnosis, there's a differential PLA and whatnot. And then most of the time we get to look at how what looks, or rather how the lesion looks, how the lesion looks, where it is situated, and all these things. So he's like, so you think there's something going on with my child? And I'm like, no, that's not what I think. And before we get to what it is that I think is going on with your child, do you live with your child? He says, no, I don't. I asked him why. No, me and the mother broke up. There was a fight and blah, blah, blah. So I'm like, okay, so ngwana o dula le mang? He's like, the child stays with the mom, the grandmother, and one of her siblings. I'm like, is the sibling a boy or a girl? Also, how old? And then he was like, no, the sibling is younger than her, and she's female as well. So I'm like, okay, does the mother have a boyfriend? Not that he knows of. Okay. Do they drink alcohol? Like, does she know how to nurture, how to take care of kids? Is she these type of people, you know what, you can do anything but stay away from my children? Is she the type of person whom, if I happen to, I don't know, slap her around, would she believe her child? You know what, I'm having this particular problem with whoever, and is the child comfortable talking to the mother? And he then looks at me and he was like, you know what, to be honest with you, I really don't know. I'm like, okay, that's fine. I would really love for you to just go back and see what the situation is. If you can have a conversation with the mother, please do so. But here at Mercy, there's really nothing I can do for you. But what I can do is write you a referral letter so that you go to the hospital. That is our SOHS hospital, right? He's like, okay, that's fine. Could you please also ask the mom to come on the day? Then he's like, why? Should I not come? I'm like, no, it's fine, you can come. But I would really love to have a conversation with her mother. Then he's like, okay. And he looks at me and says to me, you look uncomfortable. And I'm like, yeah, I am. Why? And I was so shocked that I was so transparent. Like, a person could see what I get comfortable. And look, I do this on a daily basis, and I do it with poise, and I do it so well. You know, I'm hardly ever in a situation where I find myself not confident and I find myself thrown off and scared of patients and whatever. But this time around, in my head, I was like, you know, every other time you hear stories about this person came to the practice by Dr. Who, and you know, this is what I said, and you get to also be taught how to work with children, how to ask them questions. But because it was the very, very first time I saw that, and the thought, this child could actually be a child who's being molested, you know, it kind of hit me in a different manner. You know, it just literally threw me off. Now, in my head, instead of focusing on the fact that, first of all, I need to help this child and whatnot, the first thing that came to my head, or rather the first feeling I had being an empath, was, I hope it's not happening, because we live in a cruel world. And if really anything is happening, I hope that person gets punished. Because children never know. Children are very gullible. Kids are just, they hardly recognize what's going on around them. And for me, at that point in time, I was like, so chances are something happened to this child when she was still 7 years, 8 years, 9 years old. Nobody knows. She's also not willing to tell me anything. The father does not know. The mom is not around. Does she even care? I mean, I'm not judging, honestly. It was just a whole lot of things going on in my head. And eventually, when this guy asked me, why am I scared? And I told him, you know what? I've never been abused or anything like that, ne? But when I see it happening, it like in somewhere, it ignites violence inside of me, some anger, And this guy was like, okay, so if it happens or really, this is what's going on, because I honestly don't know. What should I do? And before I could answer that, I also tell the man, sometimes these things are done by fathers. So it is very difficult for me to ask you questions if luena if I'm also thinking you could also be part of the reason why this child is like that. And I was hoping that today's video is not going to be for too long. Really, I just needed to, take it out and put it out there. As much as we deal with teeth and whatnot, it is also a very heavy cross to bear if you find yourself in a situation where you're dealing with a child who could be forced into sexual intercourse, who could be forced into oral sex and blah blah blah. So I tell this guy, I asked your child, has nobody put their penis in her mouth? And she kind of smiled in a very disturbing, innocent smile. And she didn't respond. And then this guy was like, okay, so what do you make of it, Aban? Something like, you know what, in all honesty, I don't know, but I think your child is not being completely honest. I'm not sure if the mom is going to be completely honest, but help is what we're going to give to the child at the end of the day. I mean, that's what I'm supposed to do. But at the same time, I would love for you, should we find it's what I'm thinking it is, please consider going to social workers, psychologists, whoever, who can actually try and assist this child to open up so that you can get to the bottom of it, in case it's still happening. So I went back to the child and I asked her, do you also have these lesions in your genital areas? And then she's like, I'm not sure and whatnot, So Kamabota, are you bathed by your mom most of the time? Sorry, she says yes. I'm like, all right, that makes sense, because you're still a child. And I happen to also tell her I can't check. It's not my, it's not part of what I do. It's not my scope of practice. I can't take your pants off. Please, when you get home, tell your mom to just check. Have a look and see what's going on down there, both your vagina and your anus, because we really need to know what's going on and blah blah blah. Now, when I came back, I was very disturbed by this whole thing, looking at the fact that the child was scared to speak and all of that, looking at the fact that Hutile Papa and not the mom, looking at the fact that I was also scared to speak to the parent. I don't think it's a good thing. I mean, I'm supposed to be a professional, right? And it really, really just literally threw me off. I was quite stressed, The whole of Monday, I was not okay. On Tuesday, it was even worse because I wasn't okay. And the reason why I'm sharing my experience is I know there are people who subscribe to my channel and are in the same field of study as I am and in the same line of work as I am, we are going to go through a lot, you know, in this profession. We're going to go through massive transitions. We're going to go through days when you feel like, oh, I don't want to do this. But one thing I can tell you that I learned on that day is that you need some strength. You need to be confident. You need to know why you're doing this. You also need to understand with health professionals, you have to have a certain degree of confidence or a certain degree of lack of fright, you know. It's very difficult, né? But I found myself in a situation where I had to sit and look inside and be like, yo, do I really want to do this? Or get a fine arts? Huh? Because it was just so difficult for me. And you know, I'm still finding it difficult because sometimes I sit and I think about it. I'm like, did I even ask the relevant questions? You know, did I even probe enough? Is there something wrong that I did, or did I scare the child off? And then eventually she wasn't able to speak to me. You know, she wasn't able to open up to me, or whatever. You know, so yeah, basically that's what I went through during last week. And I'm hoping that moving forward, I'll get a bit better. And anybody and everybody who's going to be watching this, guys, advice of how do you speak with older men, especially concerning such things that's got to do with girls, and the mom is not there, or whatever. I don't know. But I really am appealing to you guys. Please, guys, you know, let's just come together, have a conversation about this, because wow, flames. And as much as the differential diagnosis, you know, the rapport and all these things, they were on par, ne? Because I mean, the supervisor actually came to me and was like, you know what, I'm quite happy with your work. I'm quite happy with how you carried it out, and because she was there the whole time actually. I'm quite happy with the way you carried yourself and whatever. But I still felt there's something that's missing. I don't know what it is. I need to search for it. But that's basically what I went through. And I'm hoping that this message comes across out there, not as something you think, she also has her days where she's vulnerable and whatnot. No. I'm hoping you guys see it as the thing, okay, let's learn from what Jade has said. Whenever we encounter situations we find them difficult, what do we then want to do about them? Look, I'm one person, I do not like reflecting a lot, né? And now this year it's even worse. I have to do it for marks. I don't like reflecting a lot. But with this one, I found myself like really sitting down, thinking, you know, like digging inside of me and digging inside of me, like trying to figure out, so if this is what I signed up for, how do I ensure that I give the best of the best to the patient, to ensure safety, to ensure wafola and whatnot? Because that thing bothers her. It's actually in the middle, go her lower quadrant. Yeah, go her lower arc, sorry, not quadrant, because quadrant is like one side. Go her lower arc, it's just in the middle, midline there. So it bothers her a lot. She can't speak properly, so she says. It annoys her because she can't brush her teeth properly, and when she brushes vigorously, it hurts, and all these things. She can't smile properly. People are always looking at it, you know. But I'm really just hoping, it has nothing to do with what we were thinking, myself and the supervisor, and also what Google told us. I'm hoping it's just something different, genetic predisposition maybe. And yeah, but guys, I was really scared, which doesn't really happen like a lot. And I had to really sit and, you know, think about it, you know, get on a deep within and figure out, why were you scared of such a thing? This is not your thing. Being scared is not your thing. But the point I'm trying to make is that every other day, we find ourselves in a situation where growth happens, ne? Whether we are aware or not. Growth just happens, and some things are just going to leave you almost starstruck, you know, like you're just gonna be puzzled, you're just gonna be befuddled, and you're like, oh, wow, you know. So I'm hoping that whenever you come across anything that really startles you or really throws you off, you're going to think about this conversation, that, or rather, yeah, this video, and then you tell yourself, you know, take yourself back and be like, okay, let's stand firm, let's do the job, because that's what we're here for. But at the same time, don't forget that you're also human, you're also dealing with other human beings. So empathy is important, support is important. With health professionals, it doesn't just stop in your small cubicle, in your practice and whatever. It goes a lot beyond that, you know. It goes to a point where you need to refer, to a point where you need to put yourself in a situation where you're like, okay, but if this is what's happening, what do I do next? You know, it puts you in a situation where you must put yourself in that person's shoes. Had I been this child, would I be able to speak to just a stranger or whatever? You know, and you must always remember, it doesn't hurt, you know, to call somebody up and say, oh, I need help with this and that. It doesn't hurt, for you to refer people to the relevant departments, you know. It doesn't hurt for you to actually go and engage, you know, interprofessionally with other people, just so you make sure that whoever comes to you seeking help, seeking advice, whatever, dental treatment and blah blah blah, as long as you know that at the end of the day this person is catered for, whether through you or through somebody else, please just do it. And I'm also learning not to be scared of male patients, especially Baba Holo. You know, they're very intimidating. I don't know why. I find men so intimidating nowadays. It's just baffling. But yeah, that's my experience, and I hope you guys are going to enjoy this video. Till we meet again 2 weeks from now.